Good morning, everyone. I'm Megan Culp, along here with Scott Michlin.
Good morning. It is Monday, December 14th.
It is.
It is. In all time zones,
Yeah.
pretty much.
Yeah.
But welcome to week number
40.
Wow.
We could have a Corona baby.
We could.
Not you and I.
No.
But one could have a Corona
Right.
baby by now.
Right.
So
It is
cue
fully-
all the jokes about that.
Fully gestated. Thank you.
Yep.
There you go. Anyway, okay, week 40.
Cool.
Here we go.
Starting with science.
We're ready to go. And welcome, everybody. We're glad that you are with us. And this is week 40 for our COVID-19 Community Information Program on the KSJE. And there it is. And it's in print, so it's got to be true.
It's got to be true.
Week 40. You can't see it.
I can't. Yeah, no.
You can't see
we have technical difficulties with the TV
is
and
not, well, it's not
the
technical
studio.
difficulties because I just didn't set it up to show you.
Oh, it's human error.
Well, it's just
Scott didn't push
that
the button.
error.
Okay.
That's all it is.
All right.
But that's okay. It'll fix itself.
Oh, look. Okay, week 40.
There you go.
Yeah.
Okay. Anyway, now we're rolling on all cylinders.
Yeah.
So anyways.
Monday.
Yes.
Monday.
It
And it's all
really-
snowy and
It is snowy. It
dark.
looks pretty out there. Don't you think?
that's your take.
Except for the ice. Except for the icy patches. You know, it's very nice. I shoveled this weekend.
With didn't you shovel with like a broom?
Well, that was
Like
Thursday snow,
okay.
and then Saturday's was a lot heavier, so
It
I had to
was.
actually get out the shovel.
Yeah.
Yeah.
It wasn't heavy enough for cross country skiing though, because I tried that.
No, probably not. Anyways,
Anyway, okay.
so what's coming up on the show today? You're probably
do it.
asking yourself,
Yeah,
audience.
exactly.
You know,
Stop
and,
chit-chatting
and you
and
probably should
get to
be
the news.
asking that question because we do have a couple of guests lined up, of course, as we always do. We're expecting Jeff Bourgeois from San Juan Regional Medical Center, their CEO, to call in here and give us a live update on how conditions are faring at the hospital. And of course, we've heard from him in recent weeks that numbers are very high. They are managing those very high numbers, but again, it's always great to kind of hear what's happening. We're trying to reduce the numbers of folks that are at the hospital, so and overwhelming the system. So we want to make sure we do that. And then we're going to get an update from the folks at San Juan County because the new San Juan County Mental Wellness Resource Center is now open for business.
Yeah.
That's been in the works for a while.
Yes, I'm super excited about that. It has been in the works for a while, so we'll discuss that in a bit.
In a bit, that's true. But I think there's a lot of folks that could use what they're doing at the resource
Yes.
center certainly can help a lot of our residents. So that's a good thing. Anyway, let's go to the phones because somebody's called in. I assume it's one of our guests, but who knows? Let's find out. Good morning. You're on KSJE. Thank you so much for calling in this morning.
Good morning, Scott and Megan. This is Jeff Bourgeois. How are you all today?
Jeff Bourgeois, we are well, thank you. And belated happy birthdays to you, Jeff Bourgeois. You celebrated a birthday over the weekend. Facebook told me.
Yeah, I did. There's no secrets on Facebook.
There is no, there is
you very
not,
much.
sir. You're welcome. But seriously, we do want to find out how things are going at the hospital. So because birthdays come and go, and your numbers are still high, right, this week?
Yeah, it's kind of a mixed bag of some same news from last week, but also some good news and encouraging news on the horizon. Just our census as of this morning, again, is very high, a total census of 141. And we have 73 positive COVID patients and another 9 patients under investigation. So a total of 82 respiratory patients that are either up on the fourth or fifth floor, and maybe as of earlier this morning at 6:30, we had several holding in the emergency department. And that's not an uncommon circumstance right now. The Albuquerque Journal had an article yesterday about the hold times in EDs across the state increasing as the inpatient units are full. So patient movement is more challenging than it typically is, and it's something that takes a lot of coordination on a good day.
Right. And Jeff Bourgeois, I just wanted to, pardon me for interrupting, but that number seems very high to me from the numbers you've been reporting in recent weeks. Am I remembering that incorrectly, or is that
No, that's
accurate?
Correct. We have more than we did last week, and last week more than the week before. And it's interesting, our hospitalization numbers are continuing to increase. However, hospitalizations statewide have started to trend down just a little bit over the past 4 to 5 days. So it appears our peak is going to trail the state's peak in terms of hospitalizations a little bit. We have seen a flattening off of our 14-day positivity rate. We are just under 24%, still very, very high, but we had peaked closer to 26, 27% a few weeks ago, and the last few days it looks definitely like a plateau. So we're hopeful that trend continues, but still a very high positivity rate for the test we complete here at our hospital. Again, I want to caution listeners that that's not the countywide number. That's just the San Juan regional number, and obviously we are testing a symptomatic sicker population, so we would expect our numbers to be high, but still much higher than our peak way back in May, which was only 16%. So a lot of very sick people out in our community still. Our COVID to Home program has a census of around 70, and that's where we're monitoring patients who are symptomatic, whether or not they have a positive diagnosis or not, and checking in with them frequently to help them stay well at home, and also give them advice on what to do should their condition deteriorate a little bit. On the good news front, though, the state last week reported its some numbers statewide in terms of that R effective rate, and that's the rate of spread of the disease. And anything below 1.0 would suggest that the rate of growth is decreasing. And so for our county, which is our region, which the state calls Cibola, McKinley, and San Juan County, we are now at 0.8 as of last week. And that is down significantly from 1.3 just the prior week. So from December 1st to December 8th, we went from 1.3 down to 0.8. And the statewide number is also 0.8 as of last week. So these reports get published every Tuesday. So we're hopeful we'll see some continued improvement both within our region and within the state on tomorrow's report. So that's encouraging. And then the vaccine, of course, is all over the news. We do anticipate receiving our first shipment here at San Juan Regional Medical Center this week. Exact delivery date is still pending, but we hope to begin vaccinating employees as early as the end of this week. And then we'll receive a subsequent shipment, I believe, the next week if plans haven't changed yet. So, there's a light at the end of the tunnel. And, of course, these first rounds are for healthcare workers and at-risk personnel, particularly at senior living centers, and then eventually move into widespread community vaccination that will hopefully create the type of herd immunity, is what they call it, herd immunity, to really get this pandemic behind us.
That's actually astonishingly good news, I think, both of those things. And also, if the state rate is trending down and we're trailing sort of in that respect, does that mean...
Hospitalization rate?
Yes, that's what I meant. Hospitalization rate is trending down statewide. So does that mean that we would have the ability to, if we were meeting our capacity, transfer those folks out to other parts of the state?
Yes, it does, Megan. And we, again, work with a central command transfer center that is being run out of University of New Mexico Hospital. And its sole purpose is for adult ICU transfers, both COVID and non-COVID. And it helps level load the ICU census across the state's major hospitals. And that's working exceptionally well. The hospitalizations are still right at 900 or so, so it's still very, very heavy. That's almost 3 times what it was at the peak back in May. So, while hospitals statewide are coming down, ours are still trending up a little. But the hospitals in Albuquerque and Santa Fe are still very busy and very full, also.
Very good. And Jeff Bourgeois, I wanted to go back and talk a little bit about the vaccines, because you mentioned that herd immunity number, and that's a certain percentage of the population that then now either has the vaccine or the antibodies, right, to fight off this infection. And so it takes a certain percentage of the population to have that in order to get us to herd immunity. And even if folks choose not to take the vaccine, that could impact that amount as we get closer to herd immunity, or delay that herd immunity if folks aren't all going to take the vaccine if it's available to them.
Right. We want to encourage people when they have the opportunity of course, it's an individual decision. You need to make your own individual decisions, but we encourage you to get vaccinated. And what we understand from the Pfizer and Moderna vaccines, which are going to be the first and second to hit the market, is that their research and development and trial process was not shortcutted and very thorough, and with the FDA looking at this just last Thursday and Friday, it was felt to be safe to release this to the general public. So I've got to trust that those systems work well and that this vaccine is safe, and I am certainly going to want to take it for myself as soon as the opportunity is presented to me.
Yeah, very good. Well, Jeff Bourgeois, thank you again for joining us. We're going to take a 2-week break here coming up, but we will catch you in 2021, actually, and hopefully the news will still be trending in the good direction.
Well, I hope so, and wishing you all just a blessed Merry Christmas and a let's have a COVID-free 2021.
I agree. Hear, hear. Thank you, Jeff Bourgeois.
All right, y'all take care.
Thank you.
Bye-bye.
Bye now. That's Jeff Bourgeois. He is the president and CEO of San Juan Regional Medical Center, always giving us a great live update of hospital conditions. We appreciate that very much.
Yes. Some good news there.
It sounds like that
groundbreaking news.
Some of those numbers that are lower here in San Juan County are getting down, even though hospitalizations are still high, he said. But some of the other numbers are trending down, which is what we want if we're trying to get to green on our county-by-county reopening plan.
Right.
We need these numbers to get back down. So that's a good thing.
Well, and vaccines by the end of the week.
Yes.
It's a great
start.
That's stunning. I'm in shock.
Well,
it hasn't hit me yet.
It is that next day air world we live in, so we can get stuff across the country quickly.
Yes.
Which is great.
Using the Amazon method.
The
Amazon Prime vaccine distribution
FedEx method. That's right. But that's how we're doing it. So anyway, we're grateful for that, and we're looking forward to that. We are ready to go to our next guest on the phone. So good morning. Let's go over here. Good morning. You're on KSJE. Thank you for calling in this morning.
Good morning. This is Liza Gomez Lier at San Juan County.
Liza Gomez Lier, thank you for calling in as a part of this Mental Wellness Resource Center. We appreciate you calling in to talk a little bit about this great new resource for San Juan County. And so thank you very much. And so to get us started, can you talk a little bit about this center? I know you and I talked about it on my program, but we haven't talked about it here on our COVID program. And we know there's a lot of folks in our community dealing with COVID that could really use the resources that you are offering at this new center, correct?
Yes, certainly. So we know COVID times are adding to our mental stress and ability to cope with just the difficulties from day to day, being out of work or having increased stress at home with the kids at home. Just a variety of things. So the Mental Wellness Resource Center is a place you can call, you can email, you can go to be connected to resources in the community. We are establishing and continuing to establish partnerships with mental health resources, the providers, the agencies, along with other basic life resources that we run into if you need food or housing. So you can call, we can connect you based on what your needs are, try to help you along the way if there's paperwork that needs to be done or phone calls, appointments to be made. The Mental Wellness Resource Center is there to give you a warm handoff to the providers and facilities, agencies, resources in the community.
Very good. And I don't mean to interrupt you, Lisa, but I know we have another guest who's joining us this morning. Sue Hodgeman is also on the phone. She is the Behavioral Health Director with San Juan County. And Sue, good morning. Thank you for calling in.
Good morning. Good to hear you.
Good to hear you as well. And so with the two of you now on the program, both of you have been working very hard on this project to get this center now open. Sue, as the director of the behavioral health director of San Juan County. This is a position that came after a study that showed that our community really needs someone in your position to really help coordinate behavioral health services to the community.
That's what the report said, yes.
Very good. And and that was like the Minding the Gap report, right? And so what were you guys finding? Go a little deeper into the inspiration behind this sort of one-stop shop.
Well, it's interesting that you call it Minding the Gap. Originally, it was called the Behavioral Health Gap Analysis of 2019, but it's kind of morphed into Minding the Gap because of the work, the videos that Greg Allen did to bring all the providers together to show the public, we do have providers out there, so it kind of morphed into Minding the Gap, and I like that. So what was your question again? Sorry.
Yeah, no, I guess I know there was like a long-winded question. Going into just the inspiration of it all, I mean, part of it, right, is that frequently when it comes to behavioral health, there are these hurdles that folks experience, right?
Oh, yeah, absolutely. Making connections. First off, getting over the fear of reaching out to ask for assistance. Some people understand and recognize that they're having challenges in their life, and other people it's really difficult for them to recognize that I do have this challenge and I need some assistance in overcoming it. And so our purpose is to seek to help people who have recognized that they have a challenge to make those connections and figure out how to fill out the applications, make the phone calls, make the appointments. How do I get it paid? How do I get there? What should I expect when I get there? That type of thing. And very many people who are in some kind of mental health crisis, if they can't get those answers pretty easily, they just let it fall through the crack. And very often, because a lot of systems are difficult, especially if you're trying to deal with your health insurance or lack of health insurance, it's sometimes easy just to let it fall through the crack and say, I'll deal with it tomorrow or the next day, and then life gets in the way and you deal with it when it comes crashing down. And we want to avoid that.
Right. And Lisa, you deal with the indigent population. We know this because you're involved in the Memorial for Them claim, for example. And was that also part of the inspiration here? I mean, obviously this resource center is available to all, but was part of it sort of seeking to reach out to that population in a more focused way?
Yes, Megan, it's actually specific to those that are uninsured, who possibly are lower on the income level of resources, able to navigate the systems, certainly is our target population. In fact, all of our contracts for health services and mental health services target those that are not eligible for Medicaid, those that don't make enough income to afford health insurance with their employer, and just don't really know how to navigate the systems and how to look for resources. And so we're there to help with a warm hand. And Megan, if I could just circle back to your original question, I want to take the opportunity and Sue, you can fill in some of the some comments here too. The commission, in their wisdom, wanted to address mental health in the community because it's a problem. It's been an issue brought up time and time again in all different ways. The detention centers, the communities, the neighbors. So the commission voted to make it a priority in our works. They hired consultants to perform this gap analysis, and the document is a result of all the effort they put into interviewing different groups in the communities and really studying the issue in San Juan County, specific to San Juan County. And part of that was hiring a director and some sort of one-stop shop looking place and beyond that. So Sue's given the responsibility to continue the work and try to fill in all the gaps step by step. Probably, what would you say, Sue? Are we in step 2 of the gap?
I would say so, yeah. Step 1 was hiring the director. Step 2 was opening a resource center.
And so kudos to San Juan County Commission and putting resources towards those efforts and continuing the vision to create a place where wellness can happen in the community and people can access resources and come to a healthy place mentally, which also affects physical health, of course.
Definitely. And I wanted to ask you too, Lisa, a little bit about, these services. Megan mentioned that you deal with the indigent population, but for other folks, I mean, there's some costs. People may be concerned about costs. And so at this center, do you try to provide these services for no cost for residents of San Juan County, or what is that cost structure? You work with insurance, or explain that a little bit to us as well.
Well, Scott, we're not providing direct services. So the role of looking for a way to pay for services is identify folks in terms of what is their income level. Do they qualify for Medicaid? If they do, we can walk them through signing them up for Medicaid. If they don't qualify for Medicaid, we look for other resources. One of those resources is HCAP, or the Indigent Fund. It used to be called the Indigent Fund, where we can sign them up, determine eligibility, and that's another mechanism to pay for services. It's limited to our contracted providers, but it is something. It is a way to at least ease into or begin the process of healing or coming to wellness.
Very true. And I think you told me that on our program when we spoke a couple of weeks ago. So my apologies for forgetting that this is a resource center to direct folks to the many resources that we have already in the community, and that's kind of what it is. But I think for folks who don't know where to turn, it's a great resource to be able to do that. Right.
And I have a follow-up question, maybe, Sue, this would be sort of more in your wheelhouse, but what's the expected turnaround between I go in there and I need some resources and you connect me to a provider? How long is that gap? Like, how many days are we expecting here?
Well, so far we've been able to address people's needs within 24 to 48 hours. Because we'll sit down with them and we'll go through what they've done so far, what they need to do, what they want to do, what they're willing to do, and we'll assist them with either making the calls, downloading the applications, making their appointments, and assisting them with filling out applications. We've done that so far. Sometimes people need IDs, so we're helping them figure out, how do I get my IDs? How do I do this? Or I have an ID, but it's not valid anymore. So our peer mentors who do the actual work with the people who come in or call, they're the ones, they do a lot of research. They're learning about all the resources that are available, and they're helping connect those people. So it just depends on what the needs are, and if that resource is there, or if our peer mentors need to do a little bit more research to find it. But we have people coming in one day, and then they'll come in the next day to finish getting all the information that the peer mentor has researched for them.
Very good. And I just wanted to point out for our radio audience who can't see the address on the screen or the phone number, that, again, we can call or stop by to the Mental Wellness Resource Center. It is now at 814 West Maple in Farmington, which is right over by the hospital, correct?
Yes, it is, right on the corner of Maple and Lake.
Okay. And the phone number, because if folks don't want to come in face-to-face, because it's 2020 after all, they can call you. Right. 636-7110?
Correct.
Very good.
Very good.
Well, thank you both for calling in this morning. Again, this is a great additional resource for our community. We know there are folks, because of 2020, that are having maybe some mental health challenges, and so it's a great way to be able to say, here's where you can go to find out who can help you in our community.
Right. Thank you so much.
Thank you very much.
All right. You're very welcome. Thank you both.
Y'all stay safe.
You too. both of you, Merry Christmas. That is Sue Hodgeman and Lisa Gomez-Lier from San Juan County talking with us on our COVID-19 Community Information Program here on KSJE. A great new addition to the community.
It's actually an amazing new addition to the community because those hurdles are very real, and so people do slip through the cracks, and so it's pretty phenomenal that we have this up and running. So I commend the commission and the county and all those who worked very hard to establish this.
Definitely. So we hope folks will take advantage of it because it is now up and running, and that's been a lot of hard work too. I think. A couple of years, if I'm not mistaken.
Long time coming.
Should have asked our guests how long it's taken, but that's okay.
Monday.
But that's all
week
right.
40. It's week 40. It's Monday.
There's always lots to talk about.
Yeah.
Monday morning quarterbacking. But
that's right.
Anyway, but let's talk about some of the other numbers that we always share on this program and some of the other information that is coming out this week as I get back to go ahead and show that, and so we can see some of the testing dates for this week. Again, the testing location has moved out to McGee Park. Here in San Juan County. So again, today from 9 a.m. to 10:30. Tomorrow, December 15th, 2:30 p.m. to 4 p.m. Wednesday, December 16th, from 9 a.m. to 10:30 a.m. Thursday, December 17th, from 2:30 p.m. to 4 p.m. And Friday, December 18th, from 9 a.m. until 10:30 a.m. All at McGee Park.
That's right.
And, of course, the state health office always asks that you pre-register. There's the information on the screen. And 327-4461 is the number to call if you need help to get registered, to go out and to be tested.
Yes.
And so I know the state is encouraging folks to get tested. And, again, the more tests that can help drive down some of our positivity numbers. If we have a lot of people going and it turns out that they're negative, which is good. Which we hope. So, and then the other test, of course, the saliva-based rapid testing to get results in 48 hours is happening at Judy Nelson Elementary School. That's in Kirtland. And again, 10 a.m. to 3 p.m. every day. And you can enter off of Highway 64, kind of go around the school and go in to get that test. But that's available every day.
Right. And that one, you need to register on curative.com.
Okay.
Those are the manufacturers. So, as opposed to registering through the health department.
Gotcha.
Go to curative.com.
Okay.
It's important.
There you are.
Yeah.
So, and then we also want to remind folks about the drive-through family flu shot clinic that is happening on Friday the 18th, 12:30 p.m. to 1:30 p.m. at the San Juan County Public Health Office. And you can register back at the nmhealth.org website before you arrive. That's at 355 South Miller Avenue in Farmington.
Very good.
So there's all that's coming up. So some of that information, other stuff that we wanted to talk about too would be, of course, the latest numbers from Johns Hopkins University. They've been tracking COVID since the very, very beginning, and we are approaching another awful milestone, unfortunately, with these numbers today.
Yes. So U.S. confirmed cases are now at 16,262,304. And this is the grim milestone you're talking about. U.S. confirmed deaths are nearing 300,000. We're at 299,246.
Right. And we've been seeing daily fatality numbers at the 3,000, 3,100 range last few days, right? Last week or so.
Right.
So. And as folks will like to remind us, it's like a 9/11 every day.
Correct.
Of loss of life. So there is that. Somebody was saying, somebody on the radio this morning, probably NPR or BBC, that 300,000 deaths is like losing the city of Pittsburgh.
Right.
Yeah.
Right.
So just to keep it in perspective.
Right. Yeah. And, again, we've said this before that, at some point that number becomes so large that we lose sight of how many individual lives are touched by that.
Right.
And it's just hard for us to comprehend. And it was a long time ago now that the New York Times produced that crazy, stunning Sunday paper where the first 5 pages were just a list of names.
That's right.
It took like half of the New York Times Sunday edition to even list those out. And that was like way back in probably April or May. So,
right.
Anyway.
Be a lot more.
Just keep it in view.
Pages if they did that today. They probably can't afford to do that today.
No.
I'm afraid. So even the New York Times. But anyway, other stories, of course, that we're tracking includes the state cases in New Mexico. Again, another 1,459 new cases reported on Sunday for a total of 119,800 since March. Here in San Juan County, 149 new cases as of Sunday for a total of almost 7,923. 44 additional deaths in our state, and 3 of those were from San Juan County, for a total of now 262 San Juan County residents who have perished due to COVID-19. And there were another 1,039 recoveries reported on Sunday, which is great news, for a total of 44,130.
Great.
So we're always glad to see those numbers as well, even with those other sobering statistics. The Navajo Nation, again, reported 183 new cases yesterday and 2 additional deaths. They're now at 19,608 cases and 720 deaths across the Navajo Nation. And again, their healthcare facilities are getting full, and they are under their lockdown, their extended 3-week lockdown now until the end of this month. So the weekend curfews, all those things continue on the Navajo Reservation as an attempt to kind of tamp down some of these numbers. But their numbers are higher, like we've seen everywhere else too, unfortunately.
Right.
But again, from what Jeff Bourgeois was saying, we are grateful to hear that maybe some of these numbers, at least across the other parts of the state, are leveling off or coming down a little bit. And if we're trailing that hopefully bodes well for our corner of the state that we'll be following in those directions.
Right.
In the next few weeks or days, we hope.
Right.
So that's what's coming up. The watch list, we can take a look at that from the New Mexico Environment Department. They, of course, have update that daily. And we check it out on Mondays and Thursdays. So the latest watch list, again, these are the numbers of rapid responses to a business, not necessarily the number of cases reported at a business, but the number of rapid responses. And so, again, if you have more than 4 or more, then you're asked to shut down unless you have another agreement with the state. So as we look at the latest list, we can see Hillcorp in Aztec has 2. The AT&T store out on East Main Street has 3. At 3554 East Main Street. Overright Trucking in Farmington on Murray Drive has 2. Process Equipment and Service Company on US 64 has 2. Safeway on East Main Street has 3. Smith's Food and Drug Center on 20th Street has 2. And so there's the first page of the watch list, and then the second page would include Taco Bell at 2226 East Main Street has 2. Vector Bank in Colorado on 20th Street has 4. The Walmart Supercenter on West Main has 4. McCormick Elementary in Farmington has 2. Ojo Amarillo in Fruitland has 2. Newcomb High School in Newcomb has 2 rapid responses, Nijoni Elementary in Shiprock has 2 rapid responses, and Shiprock High School in Shiprock has 2.
Right. And maybe you can review again what a rapid response is. If it's not the number of cases, what is a rapid response?
Right. It is the number of times that a group from the health department has gone to try to then trace those individuals at that location.
Within the period of,
I think just as soon as they can, right? 48 hours, I believe, is what we've heard. So, but that's what that is. But 2 separate things. So even if there were a number of cases, then that's one rapid response. Like in a certain day, you get 3 employees that test positive. That's one rapid response.
Right. Even
though you had 3 employees.
Right.
That's the difference.
Gotcha.
But it's good. Good point. Good question.
Thank you.
Thank you.
Yeah.
So there you are. But that watch list, again, is public information. It is on the Environment Department's website. We're not aware of any other businesses that have been closed because of the number of rapid responses. Again, as we mentioned, even though that West Main Walmart has 4 and they were closed earlier in the last month, they now have an agreement with the state. So if they're testing all their employees on a regular basis, the state will not shut those essential businesses down. And of course, a grocery store is deemed as essential.
Right.
So that makes sense. So there you go. All right, everybody. I think that's all we have to share today.
Yes. Well, we do have groundbreaking news that came in.
We do.
Which is the first vaccination in the United States was delivered to a critical care and ICU nurse in New York City.
That's right.
And they live streamed that. It was a big moment.
Big deal. That's true.
Yeah.
And this morning, I think on the BBC, they were saying, these Pfizer vaccines are made in Michigan and then shipped out from Michigan. There's a factory in Michigan, and so they were talking about how as the pallets of vaccine in those highly designed containers to keep it frozen at the negative 70 degrees, whatever it needs to be transported out. They were all applauding, as these things were loaded onto the trucks to go to the airport for the FedEx, UPS delivery to kick in.
I'm so interested in the extreme temperature thing, like how they're doing that.
Dry ice for
things
part
I
of it.
think about. Yeah.
Well, from the report this morning, again BBC, they said that these were in specially designed containers with dry ice to keep them cold during shipment, and they're GPS tracked, And,
Right.
so they can keep track of them.
Sure.
And, they're monitored all the time, apparently, for, to make sure that they don't warm up before they're supposed to,
Right.
Before they get to where they're going to. And then,
Right.
of course, these medical facilities, as Jeff Bourgeois said, have these freezers that then they can then store the vaccines on premises at that required temperature.
Right. Didn't you say that San Juan College was going to offer a freezer?
I think we did. I think Mike Mestis said that on this very show. When we
Yeah.
talked to Mike Mestis, that the college had offered another freezer to the hospital to store the vaccine. That we
Yeah.
had one, I guess, lying around. I don't know.
Yeah, because somebody pulled a negative 70-degree freezer out of storage.
Let's put on the flatbed and send it down to the hospital. Yeah. That's
anyway,
great.
I
That's
know
teamwork.
it's great teamwork.
You
That's
know?
right. That's what and that's, this is going to be, I've read reports too about how groundbreaking this is when it comes to things like teamwork and it comes to the process and what this could mean for the future of medicine, that we've shored up this process and we've seen what it's like when everybody can come together on the same page and internationally, et cetera. And so
Right.
hopefully this will be a sort of a learning experience for us all.
I think that would be great.
It would
I'm
be
going to
great.
hope for that
I'm
in
gonna hope for that
2021.
too.
And of course, the other good news, I think, or encouraging news is, as this Pfizer vaccine is being rolled out, there's the next one from Moderna, which will
Right.
go through all the same procedures as Pfizer did with the FDA and their advisory
Right.
board and all that, which is supposed to happen, I believe, this week, early next week.
Right.
And so as these Pfizer cases are coming out and the vaccines, then a Moderna vaccine will be coming out as well to then again beef up the numbers to be able to access this vaccine. So again, as they're going to our frontline healthcare workers, our very elderly in nursing homes and their staff, it's going to get spread out. And I think the hope is to maybe have all those folks vaccinated by 2021, by early next year.
Sounds like it.
And then it kind of trickles down to the rest of us,
Sounds like it. Yeah.
which is good. So anyway,
Yeah.
So we're hopeful. But in the meantime, we do need to stay safe
Correct.
and continue
Wear
to follow.
a mask.
That's right.
Limit your contact.
And again, all of our hopes are to get to yellow and to green for San Juan County to allow some of our businesses to reopen. I know there's, again, a big urge to shop local. The holiday season, you can certainly shop local. A lot of our local vendors have websites, and you can go in and shop. And
Curbside pickup.
Curbside pickup, there you go. The restaurants, and there's a big drive to order takeout as much
Right.
as you can to support our restaurants, because they can't do any outdoor dining, not in the snow, for heaven's sakes. That would be,
For heaven's sakes.
That would be very cold. Well, unless you just want, I don't know. what you
Dining
want.
al fresco. Isn't that what you call it?
Definitely, yeah.
Yeah.
More fresco than usual.
Yes.
With the snow.
Yes.
But anyway, let's do all we can to support our local businesses in this time. So, and we're hope for
Yes.
a happier 2021. Again, the programming change we want to remind you about. This is our last week here on Mondays and Thursdays. We're going to take a couple weeks off for the holiday, but will continue, and I want to stress this, we'll continue to provide news updates, social media posts. We'll share from the San Juan County Emergency Management Department of any other informative news that we need to share about COVID and local conditions on KSJE's Facebook, Twitter, Instagram pages. And then we'll be back with this show on Thursdays in January. And so we're going to have more guests lined up and fuller shows once a week on Thursday. So we hope you'll continue to join us, continue to share. But we'll be back this Thursday again with another local show.
Yes.
So thank you for watching, everybody. Thank you for sharing, and thank you for supporting KSJE. We appreciate it very, very much. Stay well and stay safe, and we will see you back here on Thursday at 9 a.m. live on Facebook, YouTube, and Twitter, and again, a rebroadcast on the radio, 5:06 p.m. on KSJE.